represented by Maria Lewis here. Deputy Mayor Owens would be with us as well as a co-chair of the task force, but is unable to. So I'm going to do my best to try to fill her shoes. But I just wanted to offer a few opening comments. I'm so grateful for this opportunity for this community to learn. This past year has been a learning experience for all of us. And a few things that I've picked up along the way that I think are helpful for what we're trying to accomplish tonight. We need to share information as much as possible. There's no such thing as oversharing. Again, none of us have dealt with this before. We're all learning as we're going, and we need to make sure that we're sharing information with colleagues, with family, and with friends. And that's a big part of what we're here to do tonight, is to learn and to share. Education, similarly, it's important that we look to experts for guidance here. There's a lot of people that claim to be experts. I think we've all read up so much. We like to think that we know all there is to know about COVID, but we don't. That's what doctors are for. That's what scientists are for, and that's who we need to be listening to. There's a time to listen to your spouse, which is pretty much all the time. There's time to listen to our faith leaders, but when dealing with a health crisis, we need to listen to the experts. And so I would encourage you all to do that. And again, that's what we're here to do today. We're also here to acknowledge very openly something that many of us have known for a long time, all too painfully, that we know that when it comes to healthcare in general, that minority communities of color, are disproportionately negatively impacted by health issues and the overall healthcare system. And so oftentimes it takes a crisis like a pandemic to shine light on a problem that has existed long before the pandemic, and that will exist long after if we don't learn from this and change the system. So we want to be intentional and strategic in engaging with our communities of color and other marginalized groups that are disproportionately being impacted by COVID, and that's what we're again here to do today. With that, there's no sense in listening to me anymore, because again, I'm not an expert in this field. Thankfully, we do have a few, including the next person that I'm going to introduce, which is Dr. Bert Peterson. So thank you all for joining us, and I look forward to learning along with you.
Thank you, Mayor Walsh. As the mayor said, I am Dr. Bert Peterson, and I am representing the National Black Commission on Health. And I am a board member with the National Black Commission on Health. And we are really proud to be one of the co-sponsors of this event this evening. Our board mission, or our organizational mission, is championing Black health through advocacy, policy, and action. The National Black Commission on Health champions the promotion of health and prevention of diseases to reduce disparities and achieve equity within the Black community. And with that, I want to thank our staff in Syracuse, Denise Welsh, as well as Marlo Judge Jr., for the hard work that they're doing. Our office is located at the Southside Innovation Center on 2610 South Salina Street in Syracuse. And we're really, just want to acknowledge the two of you for all of the hard work that you're doing in Syracuse while the rest of us are down in New York City. One of the other things that I'd like everyone to know is that the National Black Commission on Health has been working with our partners in Syracuse, and we created the Black Health of Syracuse COVID-19 Coalition when the pandemic started, and we've been working together since April of 2020. The other partners involved in the work that we're doing is OnCare, which deals with mental health, Planned Parenthood, and the reproductive health work that they do. ACR Health, which works with HIV/AIDS services and housing for persons living with AIDS. YSAP, which does work with substance abuse prevention. The Census Bureau, and of course, Mayor Walsh and the city of Syracuse, which is so important. This coalition that we've put together is really a group of community partners with a shared interest. And that interest, we come together to provide outreach events, combining a diverse list of resources where we pull our resources together for COVID-19, housing, nutrition, census data collection, mental health, mammograms, HIV, hepatitis C testing, and substance abuse. And really, tonight is all about dealing with one of the biggest challenges that we're dealing with the COVID-19 pandemic, and that is the huge misinformation and disinformation campaign that we're dealing with. And I use those words intentionally. There's misinformation out there, and then there's disinformation out there, and we must deal with that. Because if we're going to get through this together, we must provide our communities, as particularly our communities of color, who for the most part historically have a lot of mistrust and distrust of the healthcare community. We must provide our communities with accurate and reliable information so that people can make those decisions that are so important during this time. So I'm not going to have anything else to say other than it's time to kick it off, because the hour will go very fast. And I'm going to turn it back over to our esteemed moderator, Councilwoman Helen Hudson.
Thank you. And so with that, we're going to start a panel discussion. And let me just say for the record, our panelists tonight will consist of Amy Tucker, Chief Medical Officer at Upstate University Hospital, Daryl Dykes, Chief Diversity Officer at Upstate University Hospital, Indu Gupta, she's the Commissioner for Onondaga County Health Department, and Maria Maladona Lewis, she's Constituent Services for the Mayor's Office. So I have four panelists that I'm going to be asking some questions, and then we'll take some questions from the chat. So my first question is going to be to Dr. Tucker at Upstate, Dr. Dykes, and Dr. Gupta. It's been almost a year since the city shut down due to COVID-19. Speak to what the initial challenges were facing the Syracuse community and how things have evolved over time, or have they? Dr. Tucker?
Sure. So I will tackle the question from the perspective of hospital healthcare, because I know that Dr. Gupta will likely address the community, and Dr. Dykes, the vulnerable populations. So I think that the journey through COVID has been one of managing scarcity. Initially, it was a brand new virus that we knew very little about, so knowledge was scarce, and any prediction about what would happen over the course of the globe as this virus spread. We did interact at Upstate with healthcare systems from around the world, including those at Wuhan, where the pandemic started, to try to get information and fill that knowledge gap to the best of our ability. And one of the things that we learned through the pandemic was if healthcare professionals all work together and share knowledge, that it can help overcome that scarcity. And we're a lot smarter about it now than we were. The second great scarcity that we had to address was a scarcity of supplies and testing. With a brand new virus, there were not tests. They had to be developed and approved and tested for safety and accuracy. And Upstate both expanded the platform of available commercial tests as they came online, and we also developed our own test so that we could provide more available testing platforms for our patients, for our workers, and for the community. We had testing sites alongside the county placed in the community so that we would have a more readily available platform. PPE was another big challenge, and it was a lot of work and effort to find supply chains for the things that we needed. to protect patients and to protect the healthcare workers so we could continue to provide care. And then as we moved through that and worked through those challenges, we began to enter the phase of the vaccine, of the pandemic that we're in now. Right now, the surge that we've experienced in the fall was well over 3 times what we experienced in the spring. And so there is scarcity of hospital beds in the area, and we work daily with the other hospitals in our region to make sure we balance the beds so that the hospitals keep enough capacity to try to care for the community as a whole. The hospitals also work together to identify scarce resources and figure out who has what so that we can share among ourselves so that no one will suffer if there's an available resource in this community. And then the final thing is treatment. We've been on the forefront of testing and developing and deploying new treatments. We have clinics now for the monoclonal antibodies, and one of our physicians has been the world's leader in investigations of the Pfizer vaccine, which is now available. Now, the final frontier we have right now is the scarcity of trust and the scarcity of vaccinations. So we have people who are very eager to get the vaccine, and we have people who don't trust the vaccine, and we don't have enough vaccine for all the people who want it, and we need to provide more education for the people who have hesitancy.
Thank you. Dr. Gupta, would you like me to repeat the question?
Ms. Hudson, I think Dr. Gupta is trying to get on the screen right now. We may need to go to Dr. Dykes.
Yes, thank you. Dr. Dykes, same question.
Sure, thank you. I'll reiterate some of the things that Dr. Tucker mentioned earlier, and there has really been an evolution of the challenges that we've faced as a community over this past year. Unfortunately, some of the challenges that the Black and Brown members of our community faced early on in the spring still persist. And at the top of that list are these issues of misinformation and disinformation that you heard about earlier. So early on, as you'll recall, there was a lot of conversation in the community in general, and then particularly in Black and Brown communities about the fact that this was a virus that didn't affect young people. This was a virus that wouldn't hurt healthy people. This was only, going to affect old and ill people. Many of these same misconceptions and actually points of disinformation persist in our community, and they have been partially responsible for this 3-time surge that we've experienced this fall. One of the things that Dr. Tucker also mentioned was that very fact. So in Central New York, we actually fared fairly well in the spring. And you might recall that many of our healthcare providers were actually deployed to other parts of the state and other parts of the country to help communities that were suffering much worse than we were. That's not been the case this fall. And we have had strains on our system from capacity, nursing staff, supplies, and medication. So I think to sum it up, if you look at the evolution of this pandemic over the year with respect to Black and Brown communities in Syracuse, unfortunately, many things have not changed. And I'm very grateful, in fact, that we are having this call tonight and actually taking steps to address that primary concern, this lack of information and then preponderance of misinformation that's in the community.
Thank you. I don't see Dr. Gupta on yet.
I am here, Helen.
Oh, hi, Dr. Gupta.
I didn't have the presenter link, so I just have to, Mr. Patterson sent it to me, so thank you. So thank you for this invitation, and I am happy to give the overview of what as a county we have handled since the beginning.
Would you like me to read the question again, Dr. Gupta?
Please go ahead.
Thank you. It's been almost a year since the city shut down due to COVID-19. Speak to what the initial challenges were facing the Syracuse community and how have things evolved over time, or have they?
Right. Our first case we had announced that was on March 16th. It's coming pretty much right here when we had the first case of COVID-19. Since then, we have seen significant number of cases throughout the community, especially a high concentration we have seen in city of Syracuse and different areas. What we have worked towards testing, case investigation, and contact tracing, and now will be the vaccination. The challenges have been significant in terms of that. How do we connect with the community regarding first case and contact investigation, specifically when we are talking from the city point of view? Do we have enough trust from the community? Do we have enough community leadership who is working with us? Do we have enough resources which we can provide to help and support people to recover when they have been diagnosed with COVID, or to support their contacts, their family members, if they don't have enough space for them to house in a separate area? So we as a county were, I think, are fortunate in terms of relatively much better resources than some of the other counties. And we work with the city and certainly on a regular basis, and put all the resources together regarding, we are talking case investigation and contact tracing part, and made sure to best of our capability that we are communicating with the members who have been diagnosed with being a COVID-19, as well as contacting and supporting their family members regarding their needs on a daily basis, if it's possible. There are many county departments were involved in that, whether it's supporting for food, or you're talking about any other needs in terms of answering their questions, connecting to the doctors. All those things were addressed, but there were challenges there, yes. And in that, we actually, if you recall, when we went into somewhat of a testing part in the phase 2 of that, as we were having a little bit more testing available, state had provided us some testing tools. And then county, also under leadership of County Executive Ryan McMahon, we pretty much put a lot of testing capability throughout the county, and targeted very specific areas based on where we are seeing cases and where testing should be done. And as you recall, that we did a town hall, something like this, to talk to the community partnership under leadership of Sharon Owens, Deputy Mayor, and also many of the partners who were there. We were successful and had remained successful in identifying places where people can go for testing, and have been able to hopefully put the fear out a little bit of that once you are tested doesn't mean that it's end of the all world. Essentially, we need to make sure if somebody is going to be going for testing, they will be given all the guidance regarding isolation period and also their family member for the quarantine. So testing goes on hands with the isolation and quarantine. Has it been perfect? No, I would be the first one to say that, but we have great partners like yourself. Many of you who are in this attendance have been very supportive of all the effort and have worked collaboratively with us, and we continue to do so as we move on to the third part of our work in COVID response from the public health point of view, from the county perspective, how we work with the city, because it is part of the county, is vaccination. So vaccinations, as we are getting whatever supply we get it in a weekly basis from the state after the allocation from the federal government, that goes out, and pretty much we have so far used our internet capability, and then with the registration link, which is more for the people who have access to computers and all. But at the same time, we have been trying to learn and trying to find ways so that we can do outreach in through the either 211 in which people can call in, and also evolving into some other places, like, for example, working with the church leadership, as you saw this past Monday with the AME Zion Church. It was wonderful to work with the church leadership, not only Pastor Jaime, but many of the pastors who were really strong partners in making that happen. We have a successful vaccination campaign there, and we registered, I think, we're supposed to do 250. We ended up having 275, which is itself is a kind of little bit of, I said not a victory, but a little bit of it feels good that we were able to do, and community actually welcomed it with the open arms. So this is just the beginning of the work which we want to do. We want to do more and more in which we will need all your support. And this work was done with the partnership with the state and the county leadership, and a lot of work was done making phone calls and putting all those things together, and it was put it in a very short time. As we have more vaccine available, one of those things which we would love to do and like to do is make sure we do these what we call small community pods in different areas, where we have a leadership of that neighborhood or community become our partner and support the effort and convince people that taking a vaccine is a good step. When I was sitting in the church and was spent pretty much good part of the day, there were a few people who came out. The husband was signed up, and so I said, "Did you get your vaccine?" They said, "No, I didn't get my vaccine." I said, "How come you didn't?" "Because I was not registered." I said, "You are here, you're going to get it today." So I said, "Really?" I said, "Yes." So can I do it in 3 weeks? I said, "Why do you want to wait 3 weeks?" So she actually took it, and it was good. Small gains of trust, I think, goes a long way. So we need your help and partnership and making sure the trust is there, vaccine is safe. We are there to vaccinate every individual as long as the vaccines continue to available. But we can only do that. Vaccines don't vaccinate, right? Availability of vaccine doesn't help unless people are willing to open their arms and open their places. So we will need your partnership. So our work has been full of challenges, but at the same time full of gratitude and also satisfaction that we could do at least maybe make a little bit of a difference in people's life, and we will continue to do so because this is our mission. And I have to applaud our leadership from both county executive Ryan McMahon and mayor who have been collaboratively working together. I have had several conversations with the leadership, so I appreciate that moving forward, and to the community partnership.
Thank you, Dr. Gupta. And before you move away, there's another question coming for you.
Okay.
Explain the difference in the COVID test.
So you can get COVID tests there are something called a molecular test, like a PCR test, and they are one other called antigen test. They are rapid tests in general. So PCR could be, or I will take it back. I would say they're rapid test and they are gold standard tests, right? So rapid test could be antigen test and the PCR test. Antigen test is not that of a high quality. It's good. It's actually good, but it's not that high as the PCR, which is the molecular test. So if you see that county has done a lot of antigen testing, which is widely available, that's what the state provided to us. It picks up a lot of what we call asymptomatic people who would be otherwise floating around in the community or the workplaces or different places, which we can put them in isolation. However, if somebody has symptoms, we do not want people to have that test done. We can have that done. So if for positive, it's positive. But if it's negative, we want them to do what we call the PCR test, which we would like to have them at the FSHED, which is done with the help of two two organizations which went. One is from the upstate with the Dr. Middleton's lab, which is with the PCR, and one goes to the Cayuga Medical. There, and Syracuse Community Health Center also does the testing, which from the beginning they were a rescue in the beginning, which were really helpful when we started that. And that's they do for the Quest lab, which is again a gold standard PCR test. The other urgent cares do rapid testing. In general, most of them will do PCR, but there are some antigen tests which are the Well Now or some other ones are doing it. So in general, for if you have symptoms, I would say if you have a doctor, certainly call your doctor. Some doctors' offices are doing it also. They may have rapid test machine. So they will guide you if that's the right test for you, or they will ask you to sign up for the with the upstate or Cayuga one in the AppShed. And then if there is asymptomatic testing, community testing has been throughout the community and different 7 days a week, actually, county has been sponsoring and has been very successful. I see the report at the end of the day, every day, how many people were positive, how many people were negative. That is nice to see. So I hope that answers the question.
Thank you. I'm gonna take a question from the question and answer. So I'm just gonna throw this one out here. This one says, I have 3 seniors over 73 years old in my care family. Where should I take them for a COVID injection? Is there a number I can call to get them on the list? They all have medical insurance.
So so you're talking about COVID, you're not talking testing, you're talking about vaccine, right?
Vaccine.
Injection, right? So yes, so we as a county has been doing community, what you call community clinics, which is in the on center at this point. We will have a new registration link will go out if the daughter who is here at 12 noon is supposed to go out a link. So if you do have a computer, certainly you can sign up for all 3 one at a time, be fast. The other one is 211, which still will have it, so you can call them. The third option will be available tomorrow, will be from Kinney Drugs. Kinney Drugs is actually, and there are some other pharmacy who have been getting vaccines from the state now, and Kinney is going to put their link out tomorrow at noontime also. They also are going to put a waiting list thing in which we will take the people from there. So at present, that's what it is. The other thing is as we move into the more community clinics, then there will be opportunities to work with the pastors, or if you're living in a, if the parents are living in an apartment complex, there might be some opportunity there. We are all looking for places where we can go and vaccinate seniors where they are, or bring them in groups if it's possible. So there are many opportunities. Unfortunately, we can't put very specific things in the link at this point. So I would say if you have access to computer, please look out at noon and then just sign them up, and they will come to our clinic, or they can go to different, I think from the Kinney's point of view, our clinic is very people friendly in a way, and so would do Kinney and every place else. If people have disability, they use walker or cane, we have a separate line for them, so they come and taken care of it. So we try to address the needs of the community members as best as we can. It's not a perfect system. I'll be the first one to admit that with this online registration and all. I wish we could have that many vaccine that we could call everyone, but certainly this is just the beginning. And also having the vaccine, we still have to make sure that we do protect ourselves with the mask and physical distancing and then hand washing and all. So I hope you can get your parents or your family registration tomorrow, and we'll look forward to see them in either on center or if they go to Kinney. I think Kinney is trying to do a clinic on center on Sunday, a large one. Otherwise, it will take them a long time to use their vaccine. They are trying to model like us, having a large clinic so they can vaccinate. The earlier the people get vaccinated, the better we are, and the more vaccine we can get from the state also. So that's the policy behind it.
Thank you. Question number 2 is for Dr. Tucker, Dr. Dykes, and Dr. Gupta. It is, what are your patients most concerned about, and how has the messaging of frequent testing and prevention strategies been received at the community level? So Dr. Gupta, since I see you, you want to go first?
Okay. So what our role has been as to do case investigations and contact tracing, as well as testing and vaccination, all 3 things in the public health. So during case investigation, what we do is our staff, our nurses or case investigator will speak to one-on-one, get the information. If there was a language barrier, of course, we use the translations services. We do provide all the education at that time in terms of what they can do, what they shouldn't do. They shouldn't be going out of the house if people are the family members in the quarantine, how long they will be in quarantine. Or if they have any symptoms worsening, what to do, when to call 911, when to call their doctor, when to call us. If they have any needs if they don't have enough food, or they have any other needs, or if they are even feeling anxious or something, can we refer them to mental health services? All these things come into the play on one-on-one. So prevention part is what we try to do with the contacts, because for the contacts who are, let's say, if I am a case, my family becomes my contact. So educate them in a way that they keep a safe distance from me, so that they don't become a case and they can get out of the quarantine. This is on one-on-one. At the larger level in the prevention messages, we have done, my conversation with the school superintendents, talking to them and promoting the same prevention messages. And also with the healthcare providers, when I talk to the medical society or talking to the health system, I think Dr. Tucker can add to how they do it in their upstate, and many of the other CMOs, they are doing in their own institutions. That prevention is the key, by using your mask, making sure you keep physical distance and social distance or physical distance, whichever you want to call that. And making sure hand washing and use of hand sanitizer. If you're sick, stay home. These are so key factors in prevention of new cases. People say we can recover. Yes, that's good, but it's like a chain. Like a chain reaction. So if you're healthy, yes, if you're young, you can healthy, you have no other underlying problem, you might do much better than somebody who is a 65 and older. If they are 80 years old, they have the underlying problem. In that chain reaction, who suffers? Our elders suffer. And that's what the prevention messages are so important within each household, that we educate our own family members. Within each employers, they educate their own staff and their own employees, and the community at large when we go out and talk in the public during press conferences. So prevention is worth better than anything else. So despite of having vaccine, I would say one of those things which when I was in the church, I was making sure I convey that message, that you got the vaccine doesn't mean that you throw away your mask and your face covering. No, you still have to don't start seeing your grandchildren and start to have the get together. No, you are not there yet, and you are not going to be there long, but it will give you, after your second shot, maybe after a week or so, a little bit more feeling comfort that accidentally, if you get exposed to somebody, hopefully you will not have the serious consequences. But even despite after the vaccine, can people get COVID? They may not have symptoms, they can still transmit. That's something we have to still continue to learn. So a lot of the precautions will be still there. There'll be a little bit more freedom people will start to feel. And I know many of the seniors were saying, we haven't gone out of our house for months, and it's very painful to hear, and hopefully the vaccine gives a little bit of a respite by the time when we have spring comes out and all, try to go out of the house and try to walk. Maybe you can start to see your kids a little bit still from a distance. Try not to do a lot of those things until we go through the cycle and we get a little bit more information about how long this will be effective. So,
Thank you,
limited
Dr.
answer.
Gupta.
Yeah.
Dr. Tucker, same question for you.
Sure. So I'm a general cardiologist, and so many of my patients are older patients with heart disease. And I find that the vast majority of them have taken the precautions very seriously and have been eager to be tested if they had concerns. I know that perspective varies throughout the population, but because of the patient population that I work with, I found that despite the loneliness and the isolation, many of them have really adhered to strict physical distancing, and they're very, very careful. And I think it's protected them physically, but it's had quite a toll, the pandemic has, on their psychosocial well-being. And I think that in terms of the people inside the hospital, we really do take the physical distancing very seriously. We've turned waiting rooms and other areas into workrooms that have socially distanced spaces and work areas, and have really tried to make sure that happens, and that people are always masked and wear appropriate PPE, because it does make such a difference. Every bit of protection that every step you take adds another layer of protection for you. The vaccine will add a big layer. The physical distancing will, the frequent hand washing, and then also masking. So each one provides additional protection for you.
Thank you, Dr. Dykes.
So yes, with respect to this question, I think Drs. Gupta and Tucker really addressed the key points very well, and I would just echo their responses. The one additional comment that I would make in terms of a concern regarding testing in Black and Brown communities, particularly our immigrant communities and undocumented communities, is the concern, the unwarranted concern, that getting tested or being traced will somehow lead them in trouble with immigration authorities, or affect their their legal immigration or citizenship when that becomes appropriate for them. And so that's a myth that we absolutely have to dispel. And these communities are certainly encouraged to get testing and be reassured that their confidential information regarding testing will not be shared with people and put them at risk in those regards.
Well, Dr. Dykes, we're going to go to a question close to that, because in the Q&A, there's a question that says, what specific type of misinformation and disinformation about vaccines needs to be dispelled in the Black community?
Would you like for me to take that, Helen?
Yes, that one was for you.
Okay. Wow. So the concerns about the vaccine itself and issues around that, mistrust issues around that in the Black community have a lot of different reasons. So we know, for example, that there health disparities exist. Black and Brown people in our society receive disparate care, don't have the same life expectancy and health status as white members of our society do. And that's for a lot of different reasons. And it's important to understand that those differences exist even when you adjust for income or socioeconomic status or education. So there's some baked in racism and difficulty that Black and Brown people in our community face with respect to healthcare. That in of itself reasonably breeds some mistrust for the system. And then we all know also about, infamous examples of where people in minority communities have been intentionally mistreated by the health system with vaccines and research studies that were inappropriately conducted. So these issues are real, but we also have to understand that this particular virus, this particular pandemic, is disproportionately affecting the communities, the very communities that we're talking about with the greatest mistrust. And so that actually makes it much more important that we dispel these myths. This particular vaccine, or these particular vaccines, are safe. They've been conducted under very, very strict guidelines, well-established guidelines, and there's no reason to believe that any group of people is being targeted with these vaccines or will be disproportionately affected by the vaccines. The trials that study these vaccines had nearly 30% participation in the research studies by minority individuals, and there are no credible reports of any kind of increased risk in Black and brown populations compared to other populations.
Okay, I'm gonna take some of the chat questions. I know our time is coming up, so I'm gonna try to run through as many as I can. Can you explain, I'm just gonna put this out there for any panelist that wants to take it. Can you explain the definition of one's legal right to informed consent by medical professionals, and what does it mean?
I'll answer that question. So informed consent is actually a standard concept that we deal with in medicine every day. All of us who treat patients have a responsibility to make sure that patients understand the condition that they're facing, that they understand the consequences of that condition, that they understand the treatment options that are available to them, and they understand the risks and benefits and expectations of any treatments that might be available to them. And then the healthcare provider works with the patient in what we call shared decision-making. We actually inform patients and educate patients about their conditions, about options, and about risks, and help them come to informed decisions about that. So in a nutshell, that's what informed consent means. Receiving a vaccine is no different. Individuals have a right and expectation to informed consent. And so when you go for the vaccines, providers will answer your questions and give you the information that you need. But it's also very complicated, and this is a new thing that we're all dealing with. So it's very important as well for us to do community information like we're doing here tonight, to talk about these issues, talk about the risk, benefits, and expected outcomes of these treatments.
Okay, we have a couple, so I'm gonna throw them out, and whoever's there, take them. How long will the vaccine last if I have COVID and don't know it? Will the vaccine still work?
So I can take that. So the vaccine, so if you have recently diagnosed with COVID, that's not a contraindication. We ask people to wait a little bit because we are hoping that, the antibodies which are developed will protect them at least for some time. Usually we go up to the 90 days. However, we can vaccinate people, but people have to be off the isolation at that time. That is very important. The only I would not call contraindication, which we screen people that if somebody has been diagnosed with COVID and was treated by antibody treatment, we certainly don't want to give them vaccine for next 90 days because the antibody response will not be that robust. That's important. And how long the vaccine effectiveness will be there, that is a $1 million question at this point. So after the second dose, the vaccine will start to show a good robust response. Even with the first one, especially for the 2 vaccines we have available, you're talking over 90%. And then second, when it comes in 3 weeks for Pfizer and 4 weeks for Moderna, then you are having further much bigger response to protect your body within a week or so. How long will it be? Will it be a year? Will it be less? It's just something we will have to see, because the emergency use authorization of these both vaccines or any one future are coming with the Johnson & Johnson and AstraZeneca, and there is emergency use authorization. It means that studies are still continuing. They are safe enough to be given, which we are taking it at this point. But at this point, how long? I think there'll be more data will keep on coming. And that's why it's so important to make sure that don't throw away your mask, make sure you're making sure your physical distancing concept continues and hand washing and staying home, all those kind of things, it's still, the mindset still doesn't have to just go to the other side. It will be somewhat better. And once we go into the fall, let's see what happens, right? Because then you have a flu, and then when we are talking about what else is happening. So it's just like an experiment in time at this point. After the vaccine, they are safe to be given. How long they will be effective, at least for several months. But is that several months leads to a year, or is that 2 years? Which is something we will continue to learn about that.
Thank you. And I'm going to try to get through as many as I can, but if we can't get to them, I'm hoping we can have another robust conversation. And you did kind of touch on the Johnson & Johnson, because I had 2 questions on the Johnson & Johnson vaccine. And is it 1 dose? The question was, is it 1 dose?
Yes, it is 1 dose. That's the beauty of this one. Everybody is waiting for 1 dose, especially for some of our population, which we think, homeless population, and somewhere which we want to just give. I think it's important. And even for elderly, and somewhere they're getting 2 vaccines, makes it 2 dosage, makes it a little bit of a painful, but 1 vaccine will make it life easier. So yes.
Thank you. And Dr. Tucker, the question was asked, with the variants of the COVID, should you double mask?
That is something that is an option for people, but there's not strong science behind it. So there's not enough scientific evidence that using a double mask is going to protect you additionally to make that a strong recommendation. But it is, I know that Dr. Fauci has suggested that it may be helpful, and it may, in fact, it just has not been studied. And some of that also may depend upon the type of mask that you wear. So certainly it's not going to hurt you to double mask. Whether there's strong science behind it is a different question.
And then I have another question that you're 3 doctors, so any one of you can answer it. 4 doctors. The question was, how long would it roughly take for herd immunity to develop?
When 70 to 80% of the population is vaccinated, that's when you begin to see herd immunity. It really is about the percentage of the population that's received effective vaccination.
And the next question, can you tell me if the vaccine is mandatory or can I refuse it?
So it is not mandatory. The people can refuse it, but I would say, I think this is what the forum is about, why people are so uncomfortable about that. There has to be a genuine reason behind when people are refusing the vaccine. So yes, it is not required at this point by anyone. There has been no indication at this point by state as well as at the federal level that it will be required. But in general, we have seen a very good response. Most of the people are, at least right now, we have less supply, so we are giving vaccines, but once we have a certain percentage get vaccinated, then we'll have to really figure it out how many people are reluctant. There was some informal survey of some organization in which they actually were able to see that people were reluctant. These are all professionals, and was sort of a little disheartening to see that many, like 1/3 of the population got, 1/3 is willing to do that, and 1/3 said, nope, we don't want it. And so there has to be, again, going back to the question is why there is a hesitancy in the vaccine. This is a big work in front of us.
Can I add to that, please,
Sure.
Helen?
Sure.
And I completely agree that it is not mandatory, but one of the things that I think is important for us to understand is vaccination is as important for you protecting other people in the community, even your loved ones, as it is for protecting yourself. And so again, we talk about
who qualifies for the immunocompromised individual. In the studies, actually, they did vaccinate individuals with HIV who had the good cell count and all, and it works. It really works in individuals. So there is no contraindication that way in general, and we will do it in case-by-case basis if that opportunity eligibility is added to the vaccination pool, hopefully in near future. Yeah.
Are there any plans to vaccinate community members who are incarcerated?
So at this point, there has not been a conversation in the New York State. I know there are some states have taken that initiative, but certainly that we will have to, again, go to the CDC and then with the state. So states can create their own priority list, but so far, New York State has pretty much following the CDC recommendation. Some of the states who have done it, they have done on their own. So right now we have not heard anything from the state coming out this way. The staff has been vaccinated for whichever, if they are willing. Most of them have been actually. And to Dr. Dyke's point, it is so important that willingness does not, even though it's not required, the willingness has to be there for people to get vaccinated. And that is watching out for other people's health is so a critical part of it. It's not about me, it's about the whole community, for whole family. So that is not the conversation which has occurred.
Thank you. So now I'm gonna bring in Dr. Gupta and Maria Maldonado Lewis. Throughout New York State, there has been a lot of conversations about test and trace. Explain what it means to trace someone, and has the city seen this program be utilized by the community? Tell people how they can access these services.
Do you want me to go first?
Yeah, since I have you, and then Maria.
Okay. So testing so when you do test, if you're positive, certainly you are going to be called a case. That's what we use the term. And the tracing is the tracing of a contact. That's what we have to kind of go through the whole history. We have to walk the path of the case wherever you went. You went to grocery store, you went to your friend's house, you went to school, you went to a nail salon, you went to a restaurant. So we are tracing your path, and with that, we are tracing path of the virus. If you went to work, how many people? So the tracing, the way we have, at least the way I am able to explain to you is at this point, is we empower our partners, especially the employers or the family members, that you have to tell the story. It's a narrative that you have to tell us what were your path. Go back in time and try to see 2 days prior to your symptoms, onset of symptoms, or 2 days prior to the test if you had no symptom. Then we will have to find all those people because you have exposed them unintentionally, and we want to protect them. So if they become a case, they will be able, that will pretty much cut the path of the virus, because they are already in the quarantine at that point. So one person will not be able to spread the virus to 10 or 20 people. It will sort of die out with one person, and then all those people are in quarantine. So the tracing is very important part of the work for employers. For the schools, we have worked with them. And even in when you're talking, you brought the issue of corrections in Justice Center. And whenever we have those cases, even in health systems, you want to find all those people by tracing. So employers play a significant role. Family members play a significant role in containing the virus. We can do only if people work with us. We cannot do anything if somebody says, oh, I don't know. And we have those situations in which people refuse to participate and say, we are not going to do that. We have used even legal ways to, give them subpoenas and force them to give us the information because they're putting their other people's health in jeopardy. But in general, the response has been marvelous. Employers are so willing. The family members, most of the time cases and family members are very willing to provide that information because people want to. In general, protect each other by tracing this concept. And we get the whole list of people from employers, from the family members. We actually, for the families, we have the apps also. So the case can, if I'm the case, I can enter the information, if I'm tech savvy, into that app, that we will have that all contact tracing, which is provided by the case. And the same is applicable to the organizations when they have a case in a grocery store or in a manufacturing places. They do the whole tracing in their organization, and that is applicable to the hospitals or doctors' offices or anywhere, that they will track the path of the virus and find all those people that should be quarantined and reduce and pretty much kill the spread of virus within their workplace or home. That's what we want to do. Are we successful 100%? No, but we are successful to a great extent. And that's how the testing and tracing works, because tests are needed to find the case, and then it goes into the tracing.
Thank you. Maria?
Good evening. So Dr. Gupta pretty much talked about tracing. It's really important. The portion of what I would like to talk about with tracing is just the importance of being able to, like Dr. Gupta said, having the trust that the information that you provide to the health department is going to stay with the health department, that the person that's going to get that phone call or that email to say that you were around someone that had COVID is going to be confidential. And that's part of, the ethics of codes and professionalism. And just to make sure that everyone knows that it's not about tattletelling. It's not about, making yourself feel a certain way because you have COVID. It's the fact of saving other lives. If you're in a store, you don't know how many people there that were vulnerable and had health conditions that you could affect. So it's about continuously building that trust with the health department and everyone that's doing the tracing, and making sure that people know that it's about saving lives at the end of the day. So tracing is something that people could take as a negative sometimes, because it's just kind of like, why do you want to know where I've been, and make a person feel a certain way. But sometimes we have to just kind of let go about us and just think about others. And I think that when it comes to tracing, the county, the state does the majority of the tracing, and the health department, of course, because they are the lead when it comes to COVID-19. So all we can do is continue to give out that education, continue to build trust in the community, and just understanding that tracing is not a negative term. It's just a reality of being able to stop COVID-19 from spreading and keeping everyone safe.
Maria, thank you so much, which you just said about the confidence, the trust. It is so important. Everything which comes to our door is confidential. Nobody shares with anyone. It just, we are very protective of any information. And it is only, the purpose of this is only to protect your loved ones and the community. It's a very important point which you brought it up. So thank you for that.
All righty, I have a chat. It says, speaking on isolation, I am aware of an individual that received a call to isolate, but they advised the rep on the phone that they were not around anyone, especially on the date provided. Why were they still receiving phone calls, including an order? Keep in mind, date of alleged contact was 110 and call not received until 119, and isolation would have ended on 120.
Right, it's a great question. So our work starts when we get the lab notification from the New York State Department of Health lab, which is because COVID is a reportable disease. So any place you went for testing, it will report to the state, and then we get that. Once in a while, sometimes we actually get direct information from the lab, but in general, it is an automatic thing. There have been often delays in receiving the results, and sometimes it gets clogs into the state system. It has been a lot better, but we still see that occasional hiccups still are happening. In the beginning, it was disaster because the system was not used to, and we had, by the time people, the same scenario as you mentioned, Helen, is that by the time we got the report, people were already out of the isolation and the whole contact was in quarantine. I just feel like why are we getting so late? So now it's a lot better. We still get the occasional thing. What I would say, sometimes we get some conflicting informations from the interviewers, or somebody has provided it. If there's any discrepancy, that's something should be, the health department should be contacted, and that can be resolved. I know I get the calls, my staff gets the call if they have questions. We have the contact, the health department also, there is a page, there are phone calls, even county executive gets sometimes from people. He forwards me all those calls, and then I will send it to my team and they resolve that. Like today I got 3 or 4 of them, and then we resolved that, and just we work through the system. There are things, because there's so many things are happening at the same time. We will have those issues, and we are here to work with you to resolve them.
Thank you. Another one from the Q&A. Known and trusted, well, comment. Known and trusted organizations are ready to share factual information about the vaccine. We need resources and materials, flyers, posters, videos, etc., in multiple languages to help get the message out. Will government and hospitals be creating these materials?
So I can talk from our point of view, then I think Dr. Tucker can talk about the hospital. From us, we have at this point, we started to at least put some information on the website, and then we are considering making some videos for the vaccine. They could be in different languages, true, but those are, at this point, is somewhat work in progress. We have continued to update our web page, which is based on CDC and State Department of Health's information, which we provide. Anything which new comes out, we try to put it in there, so you have one page you can go to. And I would encourage to all of you to at least go to the Onondaga County Health Department's COVID-19 page. There's a vaccine tab at the top, which you go to that, in which you will get all the information, including registration and some FAQs. There, a lot of information is out there. The videos we have not created, but certainly we are looking into that in the near future. And the flyers, we will probably use the same, because a lot of it is some information by the time we are using the vaccine manufacturers' flyers at this point with the Moderna and with the Pfizer, and we have consolidated the informational, what I'm trying to say, the FAQs for people asked during vaccination, to consolidate in 2 pages instead of having 5 pages with a complicated language. So again, it's something we will continue to make that better, but it is work in progress from our point of view. So.
And did you want me to add?
No.
I did. Yeah,
Yes,
I kicked off briefly, so I wasn't sure. And then, we do have the Health Equity Task Force, which is a group of people from the community, from a variety of different areas and disciplines, representing a variety of different vulnerable groups with specific needs and challenges. And the county and upstate are both involved with that process of the Equity Task Force. And we are soliciting information from the stakeholder groups about what types of information and what types of channels they would prefer and that they need. We realize that many go online, but many cannot. And so phone and flyers and other things will be developed by a communications group in touch with representatives from those vulnerable populations, so that we get the message out that they most need in the language that is accessible to them.
Thank you. Dr. Dykes, question for you. My neighbor got sick and 3 days later she died. Yet everyone else in her house that was positive barely showed symptoms. What are these hidden underlying conditions that make some people get very sick or die from COVID?
Sure. Well, what I'll tell you is there's no way to know exactly in that scenario why that particular outcome happened in that household. Certainly, we do know that there are risk factors for individuals to have severe reactions, including life-threatening reactions to COVID-19 infection. And many of those things are the chronic conditions that happen more commonly in Black and Brown communities. On that list are any things like cancer, chronic kidney disease, heart disease, diabetes, patients who are on medications for immune suppression, either steroids or because they have other health conditions, their medications make them immune compromised. Pregnancy is on that list of things that make people more susceptible potentially to COVID-19. Smoking is a significant risk factor to make some people more susceptible to severe COVID-19 infections. We know obesity is one of the risk factors, and the list goes on. So when you say that particular case example, it's again impossible to say and impossible to predict why one person might have a very severe reaction. But again, we do know that these chronic health conditions do in fact make you more susceptible.
Thank you. Oh, we have so many questions, but I have time for one more quick one before we shut it down, because we've actually gone over time. And thank you for being so gracious to stay with us for these last 15 minutes. The next question that I have, I'm going to put out here. It says, do you think tracing will undermine the public's trust in the vaccines and make them that much more paranoid?
So the tracing should not, you're talking about contact tracing, right? It should not. If anything, actually, it should strengthen it, because what you are going through right now is having exposed to somebody who is a case, and you got unintentionally exposed to that person. You want to really protect yourself in the future. Right now, when you are in quarantine, you are somewhat little concerned. Am I going to get symptoms? Am I going to get, am I going to become case now? And if you have vaccine, that really give you a pause and feel like, okay, if I am going to be exposed to, but because of vaccine, I am actually going to be protected. Doesn't mean that so one of the, I think the underlying thing which I want to highlight it here is getting the vaccine helps to reduce chance of getting symptoms of COVID, which is so important, because that's how people end up in a hospital, having so many other long-term effects in the lungs and different chronic fatigue and all those things which you saw in television and different reporting. If we can even control that part, if you get COVID, you may not show any symptoms, but you will not go through the chaos and discomfort of the disease. So should actually strengthen your desire to get the vaccine. I will make the argument in the other way around, that it should say, oh my God, if I ever get exposed to somebody, I am going to make sure I have a vaccine so I don't develop symptoms. Because some of these guidelines will still stay there until we have more data about these. People ask that question, if I get exposed to after vaccine, would I still have to be in quarantine? Yes, you will still have to be right now, because we don't know whether you can get COVID and then you may not transmit to somebody else. So, but you can protect yourself. So that is a very convincing argument for all those who have been exposed, that first chance you get, please get it as soon as you're out of the quarantine, if you are in the eligibility group. I hope I made the case.
Dr. Gupta, thank you. Dr. Dykes, thank you. Dr. Tucker, Maria, Dr. Peterson, thank you so much for giving up your remarks time. Hopefully we'll be able to take this conversation a little further in the near future. We have your questions. I'm sure that they're going to be looked at, they'll be reacted to, and you will get your answers. So again, thank you very much for this very important conversation. And Denise, thank you very much for Black Health for bringing this to the community. So I want to say thank you all.
Thank you, Ms.
all.
Hudson. And before we go, I want to thank you for the brilliant job you did as our moderator. I want to thank our Syracuse staff headed up by Denise Welsh. Thank you for everything that you did to put this together. And of course, we could not end the evening without thanking the doctors on the panel, Dr. Tucker, Dr. Dykes, Dr. Gupta, and Ms. Lewis representing the city of Syracuse, the mayor's office. You guys did a brilliant job dealing with the disinformation and misinformation that exists out there about the COVID virus, the COVID vaccine, and COVID testing. And I just want to end by saying the vaccine, it's critical and it's an important tool in everything that we have to do. But like our panelists said, please remember to wear a mask, to wash your hands, and to maintain social distancing. We have to do all of that together to fight this. And together we're going to get through this, this difficult period. Thank you so much.
Thank you all.
Very much.
Thank you. Stay safe.